We're going to go ahead and get started now. Hi, thank you guys for attending my seminar today. We will be going through NSAIDs, so non-steroidal anti-inflammatories, and responsible use of them in equids and other large animal species. A little bit of background about myself. My name is Dr. Andee Frei, and I grew up in Northern California in the Yosemite foothills area, Western trail riding, horsemanship, and the horse bug continued on to my college degree at Cal Poly in San Luis Obispo, where I majored in animal science and had a minor in equine science. And then from there, I went on to vet school at the University of Glasgow in Scotland. No, I do not have an accent, and I can't imitate one. And the fascination with large animal medicine only intensified there when I was working at the equine hospital for out of hours and also doing research on stress in dairy cattle. And from there, I went on to complete a one-year internship at Steinbeck Peninsula Equine, back to Northern California again, and then have landed here for the next 3 years or so at OSU for a large animal internal medicine residency and a master's program in comparative health science. You can see here that I'm obviously very fond of donkeys, and in my free time I love taking my highly energetic dog that I adopted from a local rescue here on runs. So our roadmap for today, we will be going through first, what are NSAIDs? It's really important to understand how they work and have a solid foundation of understanding there. Then we'll move on to what are our benefits, what's our risk, what do we need to be on the lookout for to use these responsibly, and then how can we use them in equine and also in ruminants and pigs. We'll summarize a little bit at the end, and just to prepare you, there are some poll questions, so I hope you're feeling very interactive today. Let's start out. How confident are you in selecting and giving an NSAID to your large animal? And for those of you who are in person, you can respond with A, B, C, D, or E by holding up a number finger corresponding to the answer. And there's no judgment here. If you're asking what is an NSAID, then this is a good place to be. And I'll give everyone about 30 seconds. We'll listen in from our webinar participants as well. This picture over here on the left is one of my lovely patients from last year, obviously photogenic. Okay, we're going to go ahead and end our poll now and see what your answers are. Perfect. All right, so our webinar participants, somewhat confident, somewhat unsure, kind of middle of the road, almost have a perfect bell curve there. And we have similar responses from in person. So this is a good starting point. We'll come back to this. So take a look at the image up here and then take a deep breath, because it will be pretty easy to go through it. So whenever your animal is sick or injured, the good likelihood there's some sort of inflammation happening, and that occurs because there are chemical messengers being sent out to tell the body where that needs to happen. And that seems like a nuisance to us or to the animal at the time because it's painful. but it has a purpose. It's protective, and inflammation is supposed to happen, but not all the time and not to the extent that is helpful. One of those messengers that we're especially interested in are called prostaglandins. So it's a whole family of them. And NSAIDs come into the pathway of keeping prostaglandins from being produced. So NSAIDs, we start with the name, non-steroidal anti-inflammatories. So many types of steroids can also reduce inflammation. NSAIDs do that, but they're not steroids, which seems simple, but it's helpful later. They do work on a similar pathway though. So there's different ways that these prostaglandins can be prevented from occurring, from working, from being produced. And they are by blocking these enzymes called cyclooxygenase. We'll just shorten them here to, you can see on the screen there, the first two arrows, COX-1 and 2. And a few of our NSAIDs work in different ways. So COX-1 has more of an umbrella effect throughout the body. It's involved in many different tissues. So therefore, it's associated with inflammation happening all over the body, but not just inflammation, because prostaglandins are really important for normal function of tissues, such as maintaining proper blood flow to the GI tract, specifically the lining, like the lining of the stomach and colon, blood flow to the kidneys, to the liver, proper blood clotting, and also maintaining pregnancies. So even though we want to block them to keep inflammation from happening, if we're blocking a COX-1, we need to remember that we are also interfering with all of these other functions as well. The second one, COX-2, is much more, we call it selective, because it works more in the central nervous system, so our brain and spinal cord, and blocking that doesn't have nearly as many side effects because it's not keeping the prostaglandins from being made throughout the body. It's just in the nervous system. So it still blocks pain and inflammation, but more selectively. And a few of our NSAIDs fall into different categories. So I'm sure many of you are very familiar with Banamine or Bute, aspirin, maybe even Furacoxib if your horse takes Equiox or your dog takes Previcox. Meloxicam you might be familiar with. And you can see here that Banamine and a few of the others listed above, they inhibit both of them. So that means they're super potent, but they also have a much more widespread effect, both for good and for bad. Furacoxib, meloxicam, those are more selective. So they're still effective at reducing pain and inflammation, but they don't inhibit prostaglandins in those other tissues that we've described here. So we'll touch back on this in a few different ways. And why it's important to know this is because we need to understand the pros and the cons of using NSAIDs. What's great about them is that they can have action in the central nervous system and throughout the body, as we've discussed, depending on what type, and therefore they can reduce pain, reduce inflammation, sometimes even prevent, they have what's called an anti-endotoxic effect to tamp down harmful toxins in bacterial infections or sepsis. So they're great, they're very powerful, but they can also have some really long-term devastating effects if used improperly. And I have a few examples of that here. It may look a bit graphic, but for example, our three big systems that we really worry about side effects with NSAIDs is the GI tract, specifically with split apart the stomach and the colon, and then also the kidneys. And it's also important how they're given and that the right route is chosen. So a few of these I'll go through here. You can see in the top right corner, there's an ultrasound image. It looks like a big gray slab in the middle of that cone. That's an image of the wall of the colon in a horse. And the wall of the colon should be a nice thin structure. The reason why you're seeing it like this big thick slab there is because there is a lot of edema and inflammation, and that whole gray structure is the wall, which is very abnormal, and that's specifically a condition called right dorsal colitis. So it's a section of the colon becomes terribly inflamed. It's very painful. It causes severe diarrhea and colic. It can wind up with a very costly hospital bill, a lot of pain on your horse's part. It can even be fatal. So that's a serious side effect that we look out for. We also look out for the kidneys. Like I said before, preventing prostaglandins, blocking those, it reduces the blood flow to some very important organs. And the kidneys need a lot of blood, and they don't take insults lightly. They're not very good sports like that. So when you reduce blood flow to the kidneys, it can cause long-term damage or it can cause very acute effects. And you see here, this horse is on a ton of IV fluids. It looks like it's in pretty intensive care. And that's a similar situation for what we would do if a horse had a kidney injury or kidney failure. And this can have long-term, really devastating effects for how their kidneys work for the rest of their lives. If it's severe enough, it can be fatal as well. And in the lower left-hand corner, you see what looks like that's a stomach of a pig specifically with a really severe gastric ulcer. It's so severe, no surgeon made that cut. It perforated through the wall. That's an extreme example, but they do increase propensity for forming gastric ulcers because they're reducing blood supply to the lining of those organs. So that's really important to keep in mind. And that can be as mild as a few gastric ulcers that makes your horse slow down a little bit or go off its feet a bit to really severe colic and long-term expensive treatment. And then in the upper left hand, you can see this horse had many, many cuts along its neck and shoulder. And that's because it was given Banamine as an injection in the muscle. It looks horrifying because it is, and it resulted in severe inflammation of the muscle and a really bad bacterial infection where the horse needed to have the infected tissue exposed to air. So yes, NSAIDs can be wonderful. We use them frequently because they can improve welfare by reducing pain, inflammation, preventing certain diseases from getting worse. But this is why we need to use them responsibly. And we also need to keep in mind that it's different for different ages of animals. So an NSAID that's safe for an adult horse may be very dangerous or may not be the correct choice for a 1-week-old foal. So this is why we tailor our NSAID treatments to the patient specifically. A few of these that you might be very familiar with, we have Flunixin or Banamine and Bute. You've probably seen these in a few tack rooms before. And they're very commonly used, Flunixin and Bute and Firocoxib or Equiox. If your horse has arthritis, they may be on that long term. These can all be given by an oral route. Banamine and Bute can also be given via the vein as an IV injection. Again, the way that it's given is very important. Both of these can be irritating and dangerous if they're given outside of the vein. So that's best done by a really experienced professional or by your vet. We also have Surpass here. That's another example. You may have seen it as Voltaren, and that's a topical NSAID. You may have rubbed that on one of your animal's joints before they're sore. These are all really valuable, and as a vet, I use them frequently, but there's many things I look out for in my patients and many things that I will tell clients to make sure that they're using them appropriately and avoiding those side effects we saw earlier. So when and how do we give NSAIDs? One, if your animal is on NSAIDs, it's important to be informed and to know what are the warning signs of those side effects. Things that you may be asked to monitor by your vet if you were prescribed one of these would be, are they drinking twice or 3 times as much water as usual? That one's much more subtle, but other things like diarrhea, colic signs, which can be tricky because sometimes NSAIDs are given for colic, but there's many different types. If your horse stops eating when they're on NSAIDs, that's a warning sign. These are all good to look out for. And what's really important, and I'm going to stress this many times throughout the presentation, is the best way to give an NSAID is as directed by your vet. Following the instructions really clearly is very important. So the dose, there's a narrow safety margin. That means we can't give way more than we should without risking those side effects. That's tailored to your animal's weight and also often their age or species too. How frequently? Most of these are given no sooner together than 12 hours apart, sometimes 24 hours, but it's really important to follow this because giving more isn't better. And that's either by the dose you give or by the frequency that you give it. And then also knowing what to look out for in your results to tell, is it working? So they're not going to see immediate results. If your horse has mild colic signs and say you gave it a dose of Banamine, as your vet suggested, you're not going to see your horse become more comfortable from those NSAIDs in the next 10 or 15 minutes. It might take half an hour. It could take sometimes an hour. So it's important to know that because you don't want to say, okay, well, they're still painful. I guess I need to give more. That's not the solution here. The solution is patience, clear communication with your vet, and then thinking about, oh, well, why is my horse painful? Because it's an important signal, it's important information. We don't just always want to stop it immediately. I know it's really difficult when you see your animal in any kind of pain, you want it to end. And they don't want to be in pain either. But giving more than is recommended of an NSAID could do long-term damage that you really want to avoid. So when do we definitely steer clear of NSAIDs? I have a picture over here of an example of horse colicking. So you can think of some scenarios before where you may have given some, or you thought maybe I should because my animal seems painful. I would recommend always first call your vet. They may recommend that you give some, especially if they've prescribed it before. But it's better to have that green light to go ahead than to forge ahead on your own and then have some regrets later because there's some things underlying that we may have missed. For example, if your animal is dehydrated, their gums are sticky or their eyes look sunken or they just seem dumpy. Many horses that colic are dehydrated, and you may not be able to tell just from looking at them. But when they're dehydrated, their blood volume is reduced. So going back to those easily insulted organs, the blood volume is reduced. They're already at an increased risk of damage, And you don't want to reduce that further with an NSAID right away. If you give doses too close together, we touched upon this before, so you don't want to say, okay, well, they're still painful, I'm going to give another dose now. Nope, better to wait. Call your vet if you have questions about how to give them, because it's better to get clear directions from them than to play a guessing game in these situations. Some of them aren't safe for certain categories of animals. So for example, bute or phenylbutazone has been associated with some damage to or malformations in foals in pregnant mares. So that's not always a good choice for certain stages of pregnancy. It can interfere with lactation. Also, if your horse has diarrhea, that could be due to a problem that NSAIDs would just exacerbate. They would just make them worse, and you want to stop their pain, but you don't want to give them an extra problem on top of everything else. So don't jump to giving an NSAID if they haven't been drinking, if they seem dehydrated. And if you don't know if they are, call your vet. If they have loose manure, they haven't been eating and they're dumpy, if they're weak or have signs of profuse bleeding. So going back to our foundation again, remember, you block prostaglandins, you could interfere with the blood clotting. So that's the last thing you want to do when they're bleeding a lot. If they have a history of kidney disease, you think, oh yeah, my horse was in the hospital, on fluids for a while that one time. That could have been because there was an insult to their kidneys. So these are good times to observe the red flag and call your vet before proceeding. Another time to be careful with NSAID use is in relation to performance animals. So some of you may have horses that you show and you compete with, and there's many regulations for what kind of drugs can be given to a competing animal. Whatever your sport is or whatever organization you're a part of, they probably have guidelines for what can be appropriately given before competition, because they're often drug tested. And you wouldn't want to be disqualified from a competition because your horse had an NSAID too close to when they went into the ring. You also wouldn't want to be giving them something to mask pain if they really shouldn't be competing. But whatever your organization is for your governing body of your sport, look up their guidelines, talk about them with your vet so that you can make a plan that keeps you within the rules there and also is safe for your animal. Moving on from horses to our ruminants, that's our cattle and goats and sheep and swine. So even though they may be beloved pet, a member of your family, they're wonderful animals, they are legally classified as production animals. So that means that any medication given to them has to adhere to specific laws. They also have medications that are specifically formulated for those species. For example, swine have their own type of Banamine. Many ruminants will often receive Banamine for certain circumstances, and they even have one that they can absorb through their skin. You may hear your vet talk about terms like license or off-label use, because some of our other helpful NSAIDs, which are safe to use and frequently given for certain conditions, they're not licensed specifically maybe for that condition or that species. And so it has to be recorded when something is used as, quote, off-label. And this can be a completely justified way to use them, but it just has to be recorded. And in all production animals, we have to be aware of what are called withdrawal times. So any drug that's given lingers in an animal's muscle, or if they're a milk producing animal in their milk for a certain amount of time, And legally, we want to prevent those medications, call them residues, when they hang around in the animal's body or their productions, from then being ingested by humans. So even if your animal is far, far from that fate, that still has to be observed. So that's why your vet may bring it up to you. For example, if your goat is on an NSAID and they say this is the withdrawal time, that's something that they are legally obligated to inform you of. And it's nothing shocking. They're not grouping your animal with, you know, feedlot or other production animals, but it's something that we always have to be aware of. Going into a bit more detail here on our production animal specifics. Again, we need to be aware of potential adverse effects. Some of these are really similar as what we talked about with horses, for our equids, horses, and donkeys. They can also have irritation at the site of an injection. Cattle and other ruminants can also get gastric ulcers. So their stomachs aren't set up the same way that ours or horse or pigs are, but they have a compartment that can still get ulcers that way. And we want to prevent that from happening by using NSAIDs responsibly. So again, correct dose, correct timing, correct choice of drug, and maintaining good open communication with your vet about how those drugs are being used. Swine are especially prone to getting gastric ulcers, and they can become severe very quickly, bleed, or go to worst case scenarios like we saw before. So sometimes if your animal is on an NSAID, your vet may also prescribe to them something called a gastroprotectant, which in many cases is a meprazole. People take it too. That protects the lining of the stomach so that you can avoid that side of the adverse effects while they're on an NSAID. When would we not want to give an NSAID to our ruminants? Number one, when your vet says not to, or when you're going off the cuff and decide to make your own road plan. I would advise against that. It's best for everyone to know what's happening with your animal's medication plan. If they're not eating, certain medications, of course, like horses, can't be given to breeding animals safely. So some of them aren't safe for breeding sows. Some of them aren't safe for pregnant cows or heifers. And it's important to be aware of this. Again, suspected dehydration puts that at greater risk of adverse effects. Now that we've been through the meat of this presentation, I would love for you guys to answer the poll again. Answer completely honestly. How do you feel now about how NSAIDs work, how they can be responsibly used, and what you should keep in mind if your own animal is taking them? And I'll give you guys about 30 seconds again to answer. And same rules apply for everyone here in person. You can see in the picture over here on the left, that's a donkey and a mule. It's at the Donkey Sanctuary in Sidmouth, England, but they are switched from what you probably think. So the little gray creature over on the far left, that's a mule. It's a pony mule, though she's tiny. And then we have a mammoth donkey. It's a rare French breed. He's very shaggy and soft. We were good friends. And they're called Poitous, so it's kind of a dramatic switch there. And I can see in our in-person crowd here that it looks like for the most part that people are somewhat to very confident, a few unsures, but I think, unless I'm counting incorrectly, that overall, it seems that people are a bit more confident. How does it look in the online polls?
88% are either somewhat or very confident.
Excellent. I love to hear that. And does anyone have any questions?
Yeah.
Yes.
Okay, at a boarding barn where they have different people feeding all the time. Is it very bad if you've got your AM and PM container set up with one equiox in the evening and that's it for the day? What if they mix up the containers so that they accidentally end up getting one equiox in the morning and one again at night? Is that like an emergency situation?
So I'll repeat the question for everyone in the webinar as well. To summarize, if you're at a boarding facility and there's lots of different management occurring, is it an emergency situation if a horse gets their equiox twice a day, once instead of the once a day usual? Am I correct? Yeah, so to preface, I can't give any specific advice on your personal animals today. And you may hear me repeat what will begin to sound like a catchphrase, which is give your vet a call, ask your vet. And in this circumstance, if this is a specific situation that you've had with your animal, I would encourage you to just give your vet a call, not to panic, but just ask them. It really depends on what kind of underlying conditions the horse has, what else is going on, what other medications they may be on. So if you have a question, it's worth talking to your vet about. Sure.
Meloxicam uses frequency dosage, but one of the non-pathogens. Generalized on that.
Yeah, so I did neglect our camelid friends in this presentation today. Unfortunately, I didn't have enough time to include all of our large animals. But meloxicam dosage and frequency. My first question for you would be, what has sparked this curiosity? Is this something you want to know for your own personal animal? And then I'll wait for your reply to that. Let's see. Okay. So overall, I would say if this is for your own animal, adhere to the dosing and the frequency that your vet has recommended. The dose depends on your animal weight, sometimes on their age, and also the condition. So I would defer to your vet for that. Give them a call. It might just be a 5-minute conversation, and then you'll end up with a much clearer idea of how to use them for your animal. Do we have any other questions? Yeah.
I've heard that this one lady in the barn, and she said that her vet told her it's okay, she had some injectable Andee, but it was okay to give it orally. Is that true?
That's a great question. Thank you. So to repeat that for our friends on the webinar, the question was, can you give the injectable form of Banamine orally? And you can, yes. You can give it orally. Sometimes a lot of it may splash out of their mouth as opposed to the paste form. But yes, it is a safe way to give it if your vet has prescribed it. Yeah, in the back.
I read recently that online on some horse magazine site that if you have your horse on Equiox, I don't know if it meant Bute or Equiox, but I always just look at Equiox because that's what I use.
Mhm.
It says if you're on it for long-term use, that it's a good idea maybe to take off 1 day a week. Just give it 6 days a week.
That's a great question. The question was, if your horse is on an NSAID long-term, whether that's Bute or Equiox, is it a good idea to periodically skip a day to give them a break? And if your animal is on NSAIDs long-term, giving them a 1 day break is going to, one, it doesn't give you any information. So it is important to monitor your animal's kidney function. If they're on NSAIDs long-term, and you may have heard this with your dogs too, or your small animal pets, that your vet may ask that you have regular blood work done to check on their markers of kidney function. That's really important. Giving them a 1 day break, if their kidneys are in danger, won't necessarily prevent that from happening. It's more important to alter or to detail your plan for how those NSAIDs are given based on the blood work that's done routinely. And another point that's brought up that I think is really valuable to repeat here is that giving multiple NSAIDs at once, if we think back to those pathways that we talked about at the beginning, that's hitting it extra hard. So I would never recommend stacking them, so to speak. So if your animal is on Equiox long-term, I wouldn't give them a dose of Banamine or Bute before talking to your vet, because that really increases the risk of side effects, and it doesn't necessarily help as much as it could cause potential harm. Do we have another question from our webinar chat? Let's see.
There's a few different questions about tapering off long-term usage, which I just covered, and then there's also a question about do NSAIDs that prevent you from using the manure as compost, and more like this, you know, an animal died and then on NSAID scavenger or anything else, and their side effects on them. So maybe like answering.
Yeah.
Those kind of things, please.
Yeah, those are really good questions. So let me try to remember them all in order here. And I see a couple in the chat. One to clear up quickly is Previcox is the same base ingredient as Equiox. You have Equiox and Previcox. They're both from Furococid. You should not give Previcox to your horse. It's not formulated for them. The tablets are not dosed for a horse, so it's easier to overdose them. Equiox is the same drug, but it's made up so that you can safely give it to your horse in the right dose. And as far as using the manure for compost, as far as I know, that manure should still be safe for compost. It's as long as I have been using NSAIDs and prescribing them as a veterinarian, do not know of a significant danger to the environment through the manure. They're processed through, they're metabolized in such a way that there shouldn't be active NSAIDs coming out in their manure. I could be wrong if there's newer research on that, which there's always new research coming out. So I'd encourage you to look into that yourself as well. But that's a great question. It's good to have environmentally friendly practices. And then also, as far as it being a residue in the body of an animal, say in the sad case that you had an animal that died or was euthanized and you buried it at home, or you were afraid that some wild animals may access it, there are some drugs that are dangerous if wild animals ingest them through the meat. The amount that would be the trace amount remaining in the muscle from what a scavenger can eat is not likely to be enough to damage them. I wouldn't encourage you to have any carcasses in access of wild animals because there's other things, other diseases that can be spread that way. But it's not going to immediately kill the local wildlife or damage local drinking water that leaks through the ground. And then as far as weaning off long-term NSAID use, I like your thought process about taking a careful approach to how we start and stop drugs. Steroids are definitely one that need to be tapered off. But as far as stopping NSAID use, it matters why you're stopping them. That's very specific to your animal's health and their history. So back to my catchphrase, ask your vet about that one. I'm sure they would love to hear that question and to know that you're considering these kinds of things. And another question that I see here is furacoxib actually softer for ulcer-prone horses? And if I'm interpreting correctly, you can correct me in the chat if needed. I am interpreting that as is furacoxib safer for ulcer-prone horses? And in a nutshell, if it's given in the right dose and frequency, yes, it is, because it is a more selective NSAID. It's a COX-2 selective NSAID, and it's less likely to have those side effects that we talked about with long-term use than, for example, bute or banamine. That's if it's given at the correct dose and frequency and keeping your animal's other health limitations or history in mind. Do we have any more questions from our in-person? Yeah.
Can you give any other examples of that type?
Of which type?
The COX-2 that you were just talking about?
The selective ones, yeah, sure. Let me actually go back to that slide.
So just the two?
So there's actually more types of NSAIDs than I've listed here. There's some that aren't used very frequently, but these are some of the most commonly used ones. And meloxicam is more selective, and so is furacoxib. Those are more common. Some of the other ones you're not likely to see on a prescription label for your animal. Yeah, great question though.
A few questions you may.
Yeah.
Related to mixing and reaction with their types of NSAIDs. That would be specific to your case, but maybe not in standalone shots. Pairing NSAIDs with each other and prescriptions.
Yeah, that's a good question. That's an important topic as well. So going back, one, it's important to not stack our NSAIDs. So not a good idea to give banamine and bute together or Equiox and bute. You know, you can pick and match from the list there, but we don't want to pair up NSAIDs typically because it's not going to have as much of a benefit as much as it puts them at risk of those side effects, which we actually see quite frequently. As of that, I've seen many animals that come in and they stay in the hospital actually longer because of the side effects of NSAIDs that weren't used at the right dose or frequency or for the right animal. And I would hate for you to be in a situation like that. As far as switching between them, that depends as well on your animal's specific health circumstances. Sometimes we will give them a break in between, and also being very nitpicky about making sure that they are well hydrated. If they've been on NSAIDs long-term, or if they've experienced multiple types of them. But if you could elaborate a little more, whoever asked about switching between NSAIDs, if you could elaborate a little more in the chat, that would be great, and then I can address it more specifically. And while I wait for that person's response, a few more in the chat that are great to address here. If a horse has a colic episode and they are on Equiox, is it safe to administer 1 dose of Banamine until the vet arrives? The most important part of this question is the last 4 words. You should call your vet and ask them first. I would not give a dose of Banamine and then call the vet and say, okay, they're still painful after Banamine and they're on Equiox at the same time. That could add another problem that needs to be addressed later for your horse. So I would not administer that. I can't give specific advice for your horse, but I would say call your vet first, get the green light from them before you give Banamine at that time. And another good one here, a horse, for example, a horse is on long-term bute. We see this a lot. Should they also be on a probiotic and or ulcer medication? Great question. For the ulcer medication, the anti-ulcer drugs such as the Meprazole, you see that as like GastroGuard or UlcerGuard. Those are the ones I recommend. That can often be a good idea because if they're on it long-term, that's in their system more, they could be at increased risk of developing ulcers. And that's a pretty safe drug to give, omeprazole, with long-term use. So that could be a good idea. If your vet has advised that, that sounds like a great plan. As far as probiotics go, advice about probiotics can be variable because 1, they are not all created equal. The regulations of probiotics on the market can be iffy. Some of them I've seen have great effects, but as a whole, that group of drugs does not have a lot of evidence-based advice there. So not a lot of them are USDA approved. And so their effects can be variable. You may not see them be as helpful as you want. The composition of drugs that are not FDA approved is not as tightly regulated and therefore can be more inconsistent. But probiotics can be great for encouraging a healthy gut biome, which is really important for all of the species that we've talked about today, especially the ones that depend on fermentation day to day, like horses and ruminants. So in some circumstances, good quality probiotics could be a good addition. But I can't say that they'll always be as helpful as you think they will.
The question I take along with that. The minister view the fee make any difference on ulcers and this issues.
Specifically to horses, if your animal is not eating, they probably should not be having large amounts or long-term bute. If they're a horse, they're a grazing animal. So ideally, they have food in their stomach most of the time. And that makes it easier to pick a time to give bute. Yes, I think it's a great idea to give it with food. Usually we have to try harder to get them to take something on an empty stomach than on a full one. So Usually if your horse has access to food and you give bute, you know, after a meal, that's a great time to give it. You probably don't have to look out for when they have food in their stomach as much. I know that sounded a little bit confusing, but if they have food in their stomach, then it's probably a good time for them to get bute. But it's not as much of a risk or something that we worry tons about, as in, for example, pigs and dogs, which have a different GI setup.
Just take one more from in person.
And
Go ahead.
yes, what was your question?
In cases of like soft tissue injuries,
Mhm.
do you consider it appropriate to begin administering NSAIDs right away, or do you want to wait and allow that inflammatory response to occur to promote that scarring and stabilization before you start an NSAID for pain management?
That's a great question. One, it depends on the type of soft tissue injury, where that's at in the body and the severity of it. A lot of times in those cases, we do want to prevent excessive inflammation because the body can be a bit dramatic. And to sum it up, it's in those cases, maybe, okay, we get it. It's inflamed, it's painful here, but you don't need to cause this much inflammation. So it really depends on the type of injury. Usually NSAIDs are a good choice in those circumstances if it's safe for that specific animal and given correctly. Also important to note that NSAIDs are sometimes used to reduce a fever. And the same rules apply to make sure you're giving them safely. And if your vet tells you to give that for a fever, you may not see it come down immediately. You have to wait a little bit for the effects. All right. Unfortunately, we are out of time now. If anyone in person has further questions, I'll be here for a couple minutes afterward before I return to clinics. But thank you everyone so much for attending. I really enjoyed interacting with you guys. Great questions.